Now to a Target 12 exclusive, hacking healthcare. It's a constant battle for local hospitals. They're top targets for cyber attacks by hackers hoping to get their hands on your medical records.
Target 12 investigator Kate Wilkinson shows us why this data is so valuable to bad guys and how damaging these attacks can be.
On the dark web, your medical records are worth more than your credit card or debit card, driver's license, or social security number, all of that combined. That's according to data from the U.S. Department of Health and Human Services, meaning hospitals are on the front lines of virus protection in more ways than one.
Very comprehensive.
Newly appointed CEO John Fernandez of Rhode Island's largest hospital group, Lifespan, says preventing cyber attacks is a nonstop effort.
Basically a public institution with lots of money flowing through it. And if you just think of the patient volume, thousands of patients every day.
According to the U.S. Department of Health and Human Services, 66% of healthcare organizations were hit by a ransomware attack in 2021. Johnson & Wales Chief Information Security Officer Professor Nick Tella says healthcare is one of the top 3 industries hackers go after.
What would a hacker do with medical information?
Create medical cards, health insurance cards. You know, there's more value in that. There's millions of dollars in losses associated with fraudulent medical cards.
Tella says the vast majority of these cyber attacks are through phishing. That's when the hacker sends a fake email that looks real to get sensitive information. He says that's why humans are often the weakest link in any cybersecurity network.
You can spend millions of dollars on, software and hardware to protect your systems, but all you need is someone to click on an email that offers something for free, a coupon. That's how the malware gets spread.
But cyber attacks come with real life consequences. This summer, a cyber attack caused disruption at charter care hospitals across several states, including Rhode Island, where Roger Williams and Fatima hospitals had to divert ambulances. And in 2021, a cyber attack on outside radiology equipment vendor Electa led to dozens of cancer patients having to reschedule their appointments. That was at Rhode Island Hospital in Providence, Lifespan Cancer Institute in East Greenwich, as well as South Coast Health's cancer centers in Fall River and Fairhaven.
And we get attacks all the time. You can talk to any hospital executive. You almost don't want to know.
Data from the U.S. Department of Health and Human Services reveals 17 Rhode Island-based organizations have felt the impacts of cyber attacks in the last 5 years, affecting some 80,000 people in healthcare-related breaches. That's why Tella says companies need to be proactive instead of reactive when it comes to preventing cyber attacks, but says that's not happening enough.
It's always after the fact, oh Jesus, how did this happen? How do we prevent it? But now, literally the horse left the barn.
Coming up new at 6, I'll take a closer look at what kinds of healthcare organizations Tella says are at a higher risk for cyber attacks and how hackers are evolving. With the Target 12 investigators, Kate Wilkinson, 12 News.
Now to a Target 12 investigators exclusive, hacking healthcare.
When a hospital is the target of a cyber attack, the fallout can be crippling. Patients' data exposed, ambulances diverted, and appointments canceled.
New at 6, Target 12 investigator Kate Wilkinson shows which healthcare groups are at higher risk of attacks and how this is impacting patients.
Data from the U.S. Department of Health and Human Services shows 80,000 people have been impacted by healthcare data breaches in the last 5 years. That's just involving Rhode Island-based organizations. And while the local expert I spoke with says this problem is nothing new, hackers are always finding new ways to adapt. In 2017, a laptop from Rhode Island's biggest hospital group, Lifespan, was stolen from an employee's car, impacting more than 20,000 people, according to HHS. Johnson & Wales professor Nick Tella says while there is no evidence medical records were accessed, the mistake still cost Lifespan over $1 million.
They had to report it. They did the right thing, but they still were fined over $1 million because the requirement is encryption. And they didn't encrypt the laptop.
Very comprehensive.
Newly appointed Lifespan CEO John Fernandez says dealing with the threat of cyber attacks is a daily problem for hospital groups everywhere.
It is just an ongoing expense, an ongoing effort, vigilance, testing staff so you don't click on somebody sending you hacking emails and stuff like that. But it's just a brutal effort every day.
A Target 12 review of federal data reveals that between 2018 and September of 2021, hacking and IT incidents only accounted for 11% of breaches in Rhode Island. But since then, hacking and IT incidents jumped to 86%. Tella says hospitals have been the target of hackers for 10 to 15 years now. But he says recently the shift has been on smaller physician groups.
Smaller hospitals that don't have the resources to have the necessary infrastructure in place, or it's to, spending money to train your staff.
Tella points to what happened this summer to Charter Care as an example of that. When ambulances were diverted from Charter Care's hospitals, Roger Williams and Fatima, and emergency rooms were shut down in other parts of the country. Tella believes the key to stopping these types of attacks is for healthcare groups to make the investment in prevention, an expense that could run companies $30,000 to $40,000 up front, but he says that pales in comparison to the costs of an actual data breach.
Never mind being put out of business. If you're able to get back online, if you have the necessary backups in place to go back online, you're talking about hundreds of millions of dollars. And it's just a matter of them being aware of what needs to be done. And more often than not, it's always reactionary.
Under the medical privacy law known as HIPAA, healthcare groups are required to report data breaches. But according to HHS, the healthcare industry has the highest average time to identify and contain a breach at 329 days. With the Target 12 investigators, Kate Wilkinson, 12 News.